Welcome to the fourth lesson. This presentation was developed by Thien Hancock. This module will teach them data sources, institution-based. Slide 2. These are our learning objectives. Understand common data sources for health information. Differences between population-based and institution-based data sources. Focus on institution-based resources. Review the different types. Review passive versus active surveillance. Common strengths and limitations. Reasons for bias. Slide 3. We are located in data sources and data for decision-making framework. Slide 4. Institution-based data sources are data generated through administrative and operational activities, not confined to health sector. Data from specific institution and activity. Examples: individual clinical records, service and resource records. Population-based data sources are data generated from sources that relate to the whole population. Data from all people or a representative sample. Examples: census, civil registration and population survey. Slide 5. You can look population and institution-based health information data sources. Population-based are censuses, civil registration, and population surveys. Institution-based are individual, service, and resource records. Slide 6. Which are the benefits and limitations of institution-based data sources? Benefits. They are generated routinely as part of usual activities. They does not require additional layers of collection. They are regularly collected. They can be relevant to specific services in the health system. Limitations. They are collected for purposes other than surveillance. Data guides patient care or provides information on local health facilities or programs. They are not representative of the larger population. Slide 7. Do you remember institution-based health information data sources? Individual, service, resource. Slide 8. We reviewed this table last module. Individual records are useful for every health indicators by domain. Slide 9. Individual records consist of doctor's notes, case reporting and disease records. They also include provision of services as health record and growth monitoring. Individual records contain information in disease registries, cancer. Its primary purpose is to assist care providers deliver services to individual in the system. Its content and format vary depending on services provided: outpatient record, preventive services for pregnant women, inpatient care, etc. Slide 10. If individual records are carefully designed, can provide identification of risk factors, detection of disease, outbreaks, organization of continuity of care, and longitudinal tracking, trends, to monitor treatment outcomes. Slide 11. Institution-based health information data sources are also service records. Slide 12. Service records are useful for health systems and status indicators. Slide 13. Services records were generated from facilities such as health services, police, environmental health, insurance industry, etc. It includes events such as aggregated numbers on admissions, homicides, alerts on food safety, etc. Slide 14. Service records provide information on health status and data for national statistics on health services utilization for a selected number of indicators. They allow comparisons across facilities, regions and over time. Slide 15. Resource records is another institution-based health information data source. Slide 16. Resource records is crucial for health systems indicators, inputs and outputs. Slide 17. Resource records are data on the density and distribution of health facilities, human resources for health, budgets and expenditures, drugs and other core commodities, and key services. Its primary purpose is to provide quality, availability, and logistics of health service inputs. Slide 18. Resource records assess current availability of financial and personnel data. if carefully designed, can provide a database of financial disbursement by national to subnational levels, including an overall public expenditure review, and information on health resource allocation that can be compared to other data sources that demonstrate health needs or priorities. Slide 19. The last session, we talked about characteristics of health indicators. Slide 20. The best characteristics of institution-based data sources are periodicity, frequency, validity, and feasibility. The worst characteristic is the representativeness. Slide 21. Institution-based data sources are best used for identifying outbreaks, assessing clinical management of specific conditions, trends, effectiveness, cost, and evaluating health services resource allocation. They are not good for estimating burden of disease in a population. They are poorly representative.